Dr. Liberti, your work is creating regional cooperation, work-sharing arrangements between multiple regulators, looking at innovative methods of doing that. So can you describe to us what procedures are working and how do you sort of share work between different regulators?
Sure. Thank you, Mr. Chair, and to the committee, thank you. For those of you who know CIRS, my organization, know that we can't speak without leaving some slides behind. So I have a few that hopefully will show up, and I don't know if I need to press this. Just to carry the conversation forward, I'd like to talk a little bit about the concepts that underlie the relationships.
They're putting it up.
Here they come. I want to talk about the concept of what we call facilitated regulatory pathways, FRPs. And we break them into two broad categories. The first being what we call primary FRPs. So think of a product that's going to a regulatory agency. It's never been reviewed before, but we want to expedite its development. We want to expedite its review. You recognize some of these terms here. These are what we call primary FRPs. They have specific rationale for expediting the regulatory review of important products. But if we think about the rest of the world, often what we think about are what we call secondary FRPs. There are different names for these, and you see an alternate name here. What we call secondary FRPs are what national regulatory agencies or these regional regulatory initiatives use, where they want to expedite their decision, as Gugu and others have talked about, by relying or recognizing prior reviews. So they recognize that they don't need to reinvent the wheel. They don't need to redo everything that's been done before because the product has been reviewed, but there still is a requirement to review the product in some form. You've heard about these regional regulatory initiatives already. Gugu talked about Zazibona, EAC, the WAHO, West African. We've talked about the Caribbean regulatory system, and there are a number of other ones that have evolved in different regions. So I want to tie together this concept of the primary and primarily the secondary FRP and how they have an impact on the regional regulatory initiatives. We collect data from a variety of sources, and one of the programs that we undertake every year is to collect information from multinational companies, and they provide us very specific regulatory information about the regulatory review processes of new molecular entities. Now, I'm not talking about generics today. These are new molecular entities that undergo reviews in these various countries. In the first section on the left, these are products that undergo what's called a verification review. So if you think about these secondary FRPs, in the simplest form, another agency looks at what a primary agency has done, recognizes that there's been an approval, does a relatively quick review, recognizing that the product's the same as the initial product, and quickly makes a decision about approving that product. In the green, this is what we call an abridged review. It's still based on a primary review by an agency, but for some reason, maybe the product isn't identical, the manufacturing process isn't the same, or the indications are different, there needs to be a little bit more work. So there's an abridged review done by the assessors, as opposed to a full review. Now, we're not really sure that these that are designated as full reviews really are full reviews. We think they're actually a hybrid of abridged reviews, but for now, let's go with this. But there are two things you can see here, good things and potentially a problem. The good thing is that the full review, or let's put it the other way, is that the verification review takes a lot less time than a bridge review and takes less time than a full review. So if you're using a secondary FRP, it means that it's accelerating the review process. Now remember, this includes company and agency time. The downside to this is if you look at that median bar, even for the verification review, it's still about a year, a little bit more than a year. So one might raise the question, why is it that it takes a year of company and agency time to essentially verify what's been done before? So I think as the committee thinks about these opportunities, one should think about that there are different approaches that can be used, but some of them have inherent limitations. We'll talk about them in just a minute. I created this graphic because we've been talking about these different types of approaches, work sharing, different kinds of joint assessments and centralized procedures. And you've heard about these, but I thought maybe for the committee, it might be useful to understand a little bit how these are different. If we think about the Zazibona, essentially we heard that there's a lead country and then the other countries support the review. So they come together periodically and they render a decision. In a joint assessment like the East African Community, and I'll come back to the access in just a minute, all the countries come together And sitting together, they each take a particular component, they have a specialty, they review it, and they render a group decision. And a little bit different from that, then, is what happens in the Caribbean regulatory system, wherein there are actually central reviewers that sit in Trinidad, and those reviewers then review the dossier, and they render a decision. That's also actually what happens in the European Medicines Agency. So we have kind of a group of rapporteurs and specialists who come together, and then there's the central review. What you've heard already is that bottom part is kind of the limiting step, the individual country acceptance. And in almost all of these situations, that seems to be the rate-limiting component, is that even though there can be an acceleration, as we heard in Zazibona, and even we have some statistics about CRS, works very, very quickly, it's the individual country acceptance that tends to be the slowdown. Some of you know that I completed some doctoral work looking at facilitated regulatory pathways. This is intended to confuse the daylights out of you, but essentially what it is intended to show is that there are many, many pathways that are already in place that can be used by countries around the world in terms of reliance pathways. Now, the colored metro map lines, it's a little bit more complicated, represent the capabilities of the countries. And what we've said is that not every country necessarily should be able to do every kind of review. As you've heard, not every country may have the capability to do a full review. So in those cases, they might want to do a verification review or an abridged review if they have the capability. So I think as the committee thinks about these opportunities, you should think not only in terms of what are the kinds of pathways, but who is capable of doing a particular or following a particular kind of pathway. So I just want to conclude with a couple of benefits of these initiatives where people come together and work. As you've heard, I think it allows for an efficient use of resources. It allows the agencies to focus on what we call added value activities, so no duplication, just what can I do locally that hasn't been done already. These kinds of approaches are applicable to new molecular entities, to generics, and to some other components too. We'll talk in just a minute. I think it enhances alignment or convergence with standards, and I think that's important. You've heard that for the last day, that bringing standards into play is really critical, and that then reduces the burden of duplication for sponsors. That's really important, and it improves what they call process predictability. Not that they know that they're going to get a positive outcome, but if they know what the process is, it allows them to understand how to address the needs of the regulator more efficiently. These kinds of initiatives, we held a workshop last year in South Africa and learned that they're actually very useful in reducing the backlog of post-authorization commitment reviews and labeling changes, which are often a very big burden on regulators and not necessarily talked about a lot, but take a lot of effort on the part of the regulators. And there are challenges. So certainly one of the things we've heard is that there's a reluctance on the part of the regulators, the assessors, to actually rely on prior decisions. You know, how can I trust somebody? How much should I actually rely on the other authority? We've heard about grading systems, benchmarking tools, et cetera, to try to bring an element of trust to those decisions. One of the questions is, what should I review if I'm an assessor doing a secondary FRP? What are the elements I should review? And we're actually doing a survey now, hopefully we'll have it concluded by our March workshop, where we're interviewing regulators around the world, primarily from the low and middle income countries, to find out, what do you review when you actually do a verification or an abridged review? And we've heard over and over again this concept of political will and other will, institutional will. So you need to have a driver that makes this work. I think sometimes there are unrealistic expectations from industry about these approaches, and say, well, you know, it's simply a verification, so it should only take 20 minutes or whatever. We have to be realistic about the kinds of activities that still have to happen. And as Dr. Yarbus and others have talked about, post-approval systems to manage pharmacovigilance, and then these changes are really going to be critical for these things. We've touched on this, but I think this concept of the legal framework that's in place is often the limiting factor. Many countries want to put these into place, but they can't. And I think that's something that, you know, we may sit on the outside and say, it would be great if they could do a verification or an abridged review, but unless their legal structure allows it, that one size doesn't fit all. We often hear from regulators that the companies don't know what to submit and their dossier submissions are poor. So there's two sides to this coin. It's important to know that you have the right requirements published, and we talked about transparency a lot over the last few days, but the companies need to have the right submission approach. And often the countries will say, look, in order for me to make a decision, I need to have an assessment report from the primary agency. And I want it to be unredacted. It's a really critical component. And these can be very hard to get and can actually be a delay. It may take a year to get an unredacted report. And then you say, well, why is it taking a year to do a verification? Well, because that's a rate limiting step. So as you're thinking about processes, think about all of the elements that are required to actually make these things work. And I think the important thing right now is that there's no mutually recognized framework for a reliance assessment. So how do we solve this? My final bit is that I think regulators should be focusing on this added value. I think that's true. Somebody brought this up yesterday about, now, how can you not do all of these regulatory activities and still be fit for purpose? Well, you may be, because within the context of your country, doing maybe a verification review is fit for purpose. That's absolutely appropriate. And I think the industry needs to align on what their submission presentation will look like, and we can talk about that more a little bit later. We've talked about training and transparency. And we are involved now in working with WHO and with the Singapore group to develop a good reliance practice guidance. So this is going to be reviewed at our workshop in March, and we're looking forward to how that will evolve the whole conversation. So I hope that's given some background, try to put some things in context. And
Thank you, Larry.
some nice slides you can take home.
Thanks, Larry.